Welcome to Chat About with Rosalee Henry. Hi, everyone. Welcome back to Chat About with Rosalee Henry, where we have real conversation, one conversation at a time that transform lives. And today we have Lainey Stancil. Lainey, thank you so much for being here. Lainey is a birth doula, a postpartum doula, a childbirth educator, and she has founded the Peach State Coalition. Lainey, I'm so happy to have you here with me today. So we're going to jump right into it. You're passionate about what's going on with the birth world. What gives you this passion to be an advocate for mothers, birth workers, and the whole maternal community?
Well, my advocacy started really. It really just kind of blossomed from me going through pregnancy and kind of feeling the gaps that are here in Georgia, and then realizing that there was something that could be done. And nobody else was doing it, so I figured, why not me?
That is incredible. So, what would you say the emotional impact of no support does to a family?
Well, I mean, for me personally, I was seeing an OB in the beginning, which was what I thought was just the normal kind of flow of when you got pregnant. We actually struggled with infertility, so that was kind of the route we had to go. And then I realized that I wasn't really getting any education on birth. I didn't get any I didn't feel like anybody was explaining to me what was going to happen, and I just felt like I was being kind of dismissed at every appointment. And so I was like, every mom is probably feeling like this. And so I left an appointment and decided after that appointment that I was going to pursue having a home birth, which I quickly found out that here in the state of Georgia is not easy to do. So that kind of was like the start of really this journey for how I founded Peach State and my birth journey as a whole.
Wow. So based on you creating the Peach State Coalition and your personal experience, what would you say are some of the hidden gaps that you are now uncovering in Georgia when it comes to maternal care?
I mean, for one, there's almost too many to count, but for sure, one is education. There is not a lot of avenues for moms to get birth education in the state of Georgia. You can get a small class with your hospital that you're going to, but it's usually like a one-day sort of thing. It's not extensive or comprehensive. It doesn't always really involve your partner or your support person, which I think is really important. And so that's definitely one of the largest ones that we have here in Georgia. And then I think that the other one is just access to care in general. That's another huge one here. With us not having every pathway of midwifery licensed, you're limited. You're really limited to what you're able to access, and that means that some moms are not getting care at all, which is, as we know, working in the birth world is not good. So yeah, I think that definitely education, access are two of our biggest gaps, along with just the fact that there's a huge area of maternity care deserts here in Georgia, and with that, it's simply just distance. There's nobody out there in northern Georgia and southern Georgia to even be able to go to these moms or for those moms to go to. So I think that is another huge gap that we have here in the state that needs to be addressed.
Yes, I'm so glad you touched on that because that's one of the focus area that Mothers Helping Hands has dived into. And now we have created trainings that is approved by the state of Georgia. So now we will be able to go out into the community and train those caregivers who already have the experience in healthcare but still need that upskill. Because I'm sure you've noticed in I would say the last 5 years, there are so much more birth workers or people who are coming on board. I hope it's not just because of the trend.
Yeah.
Because we know some people are definitely passionate about it, but we want to make sure that those candidates, those caregivers, those community health workers who are going into the homes to help the families are trained.
Yeah.
And that's something that Mothers Helping Hands is so passionate about and will be pushing and be going after and be educating and training more workers. So we'll be able to fill those desert gaps.
Yes, yeah.
Because that's so important.
That is so important. And I think, too, that I think that there is a lot of people that think that being a doula or being a midwife is like this new trendy thing, but it's honestly what, like, I feel like it's the foundation of what birth is. So yeah, I think that it's so important to expand on that and make sure that everyone who wants to be a part of the birth worker world can and has the opportunity to be educated to help moms the correct way.
The correct way. Because we know support changes everything. When a mom or a family feels supported, but we want to make sure that they have the right support. And the people who are going in to support them have the foundation, they have the education to make sure they help. So thank you so much for this episode, Lainey. We will be right back after this break to continue to talk more about the maternal community. Hi, I'm Rosalee Henry, the seven-figure doula whisperer and founder of Mothers Helping Hands Atlanta. Over the past 2 decades, I've had the privilege of training, mentoring, and partnering with doulas and maternal health professionals all across the country. And the one thing I've learned is this: even the most passionate birth workers struggle when it comes to building a sustainable business. That's why I created the Mother and Mom Toolkit, Business in a Box plus GPT, your AI growth partner, a complete, ready to launch business system designed to help doulas move beyond burnt out and build a thriving, profitable career. It's not just a toolkit, it's a done for you business model that includes brandable templates, client guides, marketing assets, and an AI powered assistant that helps them automate and scale with ease. I'm now partnering with doula trainers, educators, and certification program directors who want to offer their students more than just a birth education. They want to give them the tools to build a business that lasts. By collaborating, you can bring the system directly to your trainees and an additional income stream to your own program and empowers every graduate to walk away with a real business, not just a certification. If you're a doula trainer or organization ready to expand your impact, I'd love to connect and explore how we can work together. Click the link in this post to learn more or send me a message. Let's collaborate to help doulas serve smarter, earn more, and create a sustainable career that changes lives. The Mother and Mom Toolkit Business in a Box plus GPT, empowering doulas to grow with confidence. Let's build something that lasts together. I look forward to talking with you. Welcome to Chat About with Rosalee Henry. Welcome back to Chat About, and we have Miss Lainey here with us, and we're discussing maternal health, birth support and educational support in the maternal community. So, Lainey, how would you say that the lack of support affects maternal and mental health?
Oh, I mean, I feel like that's everything. I think that having lack of support is exactly what changes your entire birth and postpartum. If you don't have enough support, how are you supposed to get through birth? How are you supposed to raise a baby, especially on your first? You don't know what you're doing. No, nobody knows what they're doing. And without that support from either your provider or your spouse or your partner, I think that it just means everything.
That's so true. You mentioned partners. How do you help as a childbirth educator? How do you help the partners to feel emotionally supported or even physically supported? Because sometimes we know the partners, they feel left out.
Oh yeah. I think that the biggest thing is that just involving the partner in every aspect of the pregnancy, of the appointments. I know not all partners are able to go to appointments, or they have to work, or whatever that situation is. But in terms of the education, I think it's so important for them to be a part of that education and to realize that it's their baby too.
Yes. Sometimes when we are helping clients, we feel like the partners are not involved. And sometimes it's not because they don't want to be involved. Sometimes it's because they don't know how to be involved. So we always make sure that we involve them in everything that's going on, especially if they want to.
Yes.
So we make sure that they do not feel left out. The next thing we want to talk about is the postpartum recovery support. As a postpartum doula, me being a postpartum doula, we see what goes on. We see what support it looks like when it's available and what support looks like when it's not. So, based on your experience, how do you see support being received or more needed when it comes to recovery after birth?
I think that moms need support. Not every mom has access to a postpartum doula. Not every mom necessarily needs a postpartum doula if they have a village of their own.
Exactly.
But I think having some sort of support after birth is so important. Being able to have a postpartum doula definitely helps when it comes to that early diagnosis of things like anxiety or depression. And I think that when you can get ahead of those things, it makes that recovery a world of difference. It takes you from being, not knowing what you're doing and thinking, everything is just everywhere, to kind of narrowing things down and realizing that you do have people who are behind you and you can raise this baby.
Yes. I know you mentioned sometimes not everyone needs a postpartum doula because they have a village, but they do need that education.
Yes.
Because a lot of times the villages that we have, it's different from what is the norm, right?
Yeah.
Because a lot of times the village may be your grandparents,
right,
and their views and their culture is different from the standard now.
Very true.
So the education is very, very important.
Yeah.
You also touch on the village. We cannot stress enough how important it is to have a village. The community is very important.
Oh yeah.
So what are some suggestions or solutions you have when it comes to building that community, building that support team that's needed, especially after birth?
I think that, for one thing, some people are not very outgoing, and if they don't have family who's in town, maybe it's harder to find those groups. But that's something that Peach State I wanted to kind of create. Being somebody who, I didn't have a lot of mom friends whenever I had my son. A lot of my friends didn't have kids yet. And so I wanted to create that space for moms. And there's so many other people that have groups like that out there. There's walking groups and play groups where you can go to the park, and sometimes you just have to put yourself out there, because I know I feel so much more at home and at peace when I'm with other moms who are going through the exact same thing as me. And I think that that's something that moms sometimes have to like step outside of their comfort zone and get out there to meet other moms, because that's where you feel your village the most.
That's it. We cannot talk enough about villages
Yeah.
because that is so important. So when it comes to the community, we know that the birth impacts not just the families, but it also impacts the community. So, Lainey, we're going to take a break and then we will be right back.
After a successful inpatient procedure, a prominent star from TLC's 1,000-pound best friends begins her journey to recovery with personalized care from Mother's Helping Hands Home Care. Trusted and recommended by her doctor, we're here to ensure a smooth and comfortable transition home. Featured prominently on TLC, Mother's Helping Hands Home Care is your trusted partner for professional care.
Thank you for watching Chat About with Rosalee Henry. Welcome back, everyone. This is Rosalee with Chat About. And we have with us Lainey. And we're talking about the crisis right now that's going on, especially here in Georgia, when it comes to the maternal community. Lainey, what changes do you think is needed right now in Georgia to make these moms much safer?
Well, for starters, I think that the biggest thing that could really help in our state would be to have all pathways of midwifery licensed. That's something that has been near and dear to my heart. A lot of the other people that I work with, other organizations, and my own personal midwife, that's all something that I think would make a huge change. The midwifery-led care model is a proven care model that changes outcomes in birth. And we are one of only 13 states that do not license all pathways to midwifery. So I think that would make a huge change in our state. And then I also think that integration, so like the way that hospitals and home birth and birth center births could all integrate together and come together. It's not about competing against one another. It's about coming together and doing what's best for the moms here in Georgia. And I think that would make a world of difference in our state.
Like we mentioned earlier, we need to continue building that village for the moms. We definitely need to continue building that village for the birth workers, making sure that the moms who we are caring for have the support that they need. There's so many birth centers that are being closing right now. And closing the birth centers and still fighting midwives to get that license, to get that support, is going to be a detriment to what's going on. We're going to be losing more moms.
Yeah.
Definitely.
Yeah, it's a real problem here. I actually just was working on something that we were actually ranked 49 in 50 states, which is terrifying.
It is terrifying.
For maternal health and for our birth outcomes. So being 49 out of 50 states, like, that doesn't make me feel proud to live in this state. And I want to be proud to live in the state that I'm from.
It is definitely a crisis, but at the same time, I'm very hopeful that what we're doing, having this conversation, pushing policies, making sure that mothers, families are supported and have the support they need. We just have to continue doing what we're doing. We have to keep advocating, keep pushing, keep talking, keep bringing awareness, especially not only for the birth, but beyond. Because as you know, what the statistics shows, the large amount of deaths that occur during the maternal journey happens after mom get home. And that's because there's lack of support. So I do understand where you started, the founder for Peach State Birth Coalition. So can you tell us more about what that is and what's your mission and how is that going?
Yeah. So Peach State Birth Coalition is a grassroots consumer-based organization, and our biggest focus right now is birth education. Birth education, as we spoke about, is so important, and there's just not enough access to it. So what we are trying to do right now is we are starting a program where we are going to have free or reduced cost birth education classes in these rural communities where there is no access to birth education. So that way moms can come and they don't have to worry about the price tag. They don't have to worry about, driving all the way to Atlanta or something like that. It's right there in their space. So that's kind of like our first big thing. Our second thing, as I kind of mentioned, was community. I wanted to build something where moms feel like it's their home, no matter what they choose, whether they choose a home birth, a hospital birth, a birth center birth. It doesn't matter where you birth. It's just that this is a safe place for you to find community. And then lastly is just our advocacy work for policy here in the state. I try to go to the Capitol when I can and go to all the advocacy days and try to just put as much information out there. I specifically use Instagram and try to just leverage that to educate the masses about doulas, about midwives, about all the options that should be available in our state but are not.
That is so true. Important part where you said you're pushing that information, the awareness, making sure that everyone know that this service is available. Like for me, a lot of time when I talk to someone about the postpartum period, they're like, I never know that this service exists.
Yeah.
So I'm making sure that we talk more about it, because the more we talk about it, the more awareness we push, is the more the families will have the information they need, that they can make the decision that, okay, we need this service, right? This is not luxury. This is something that we need to survive.
Yeah.
So how can I plan for it? I always say you don't need a $10,000 baby shower, or a $10,000 gender reveal. What you need is real support through your birth and after your birth.
Absolutely.
Because that is very, very important. So Lainey, if you have one takeaway for the listeners about the crisis that we have right now, and how both you and I, as postpartum doulas, as birth workers or birth educators, can push this information that they know that our services exist. We're here and we want to be part of your village.
Yeah, I think that the biggest thing is that just to realize that there are so many birth workers out there, and a lot of them use things like Instagram or TikTok or things like that to educate, and just finding them and building that village, reaching out and asking questions. It doesn't make you a bad mom. It doesn't make you, it doesn't make you seem like you don't know what you're doing. None of us know what we're doing. we're all just living this life for the first time. And so I think that just opening yourself up to realizing that you can ask questions, you can find out how to build this village to make your birth a better outcome, so that you don't have to leave your birth with trauma, and so that you can come out of it and be like, wow, that was amazing. Maybe, yes, it's painful, don't get me wrong, but that was an amazing experience. I feel so supported. I feel so heard. And now I can raise this baby or have more babies and just flourish.
I know. Well, Lainey, thank you so much for being part of this conversation. And like you said, we don't have to be afraid. But at the same time, we have to be so careful of the information we also getting on social media.
Very true.
Reach out to someone who's trained, who have the experience, who's licensed, and is going to give you the correct information. So until next time, this is Rosalee Henry with Chat About. You can reach me at mothershelpinghandsatlanta.com. Thank you so much. Thank you for watching Chat About with Rosalee Henry. Hi, I'm Rosalee Henry, the seven-figure doula whisperer and founder of Mothers Helping Hands Atlanta. If you're a doula trainer, educator, or program director, I want to talk to you about something that's been missing from our industry for far too long. A real pathway to help doulas build sustainable businesses that last. So many amazing birth workers enter this field full of heart and purpose, but within a year or two, many are burnt out, underpaid, or forced to step away. And when that happens, we lose more than a business. We lose access. We lose representation. We lose another chance to make an impact in the fight against maternal mortality. That's why I created the Mother Mom Toolkit Business in a Box plus GPT, your AI growth partner, a complete, ready to launch system designed to help doulas build a sustainable, thriving career. It includes everything they need to start and scale: client templates, marketing tools, business system, and now AI automated to help them manage operations and prevent burnt out. When doulas have the structure, system, and support, they stay in this work longer, and that continuity saves lives. I'm now partnering with doula trainers and educational organizations who want to give their students more than just a certification. They want to give them stability, confidence, and a model for long term impact. By collaborating, you'll empower your graduates to build real businesses while helping reduce burnout and strengthen maternal care in every community. If you're ready to expand your impact, to be part of the solution, I'd love to connect with you. Click the link in this post or send me a message, and let's talk about how we can work together to empower doulas, prevent burnt out, and make a real difference in the maternal health. I look forward to talking with you.